Welcome back to Healthwise. With us is Dr. Gabrielle from Opelousas General Healthcare Systems. And we were talking about diabetes and how obesity correlates to it, and you know, it kind of goes hand in hand. Doc, what if someone has diabetes and, you know, we're talking about the type 2, which is, like you said, kind of sometimes it's hard to detect or whatever. It doesn't give, you know, it's just not, someone just doesn't go into the diabetic shock or anything like that, you know, and you don't know, and then you find out. If they have decubitus, what was the regimen for that? What would you do, you know, if to try to combat that?
To try to prevent for them to having a foot ulcer? Well, usually when we have already diagnosed a patient with diabetes, there's certain kind of monitoring that we have to do. It's basically, for treatment of diabetes, it's kind of like a teamwork. It's all to do with basically the primary care doctor, with the nurse, dietitian, even psychologist if it's necessary. Usually we try to monitor the patient at least 3 to 4 months. Even some, they would want, you know, to be seen monthly. That depends on how well controlled they are, but, you know, in regards to their blood sugar levels. Okay. For the foot exam, we usually do a yearly foot exam. You have to test for how their nerves are doing, the sensation, even check on the ankle reflexes. And this is something that is done in the office. We can do it once a year. Also, another thing is the eye exam is very important for anyone who's been recently diagnosed with diabetes, because we don't know how long they have had diabetes. So usually they may have several years having probably diabetes type 2, and already they have damage, even the retina and the eyesights already.
That's a good topic right there. A lot of people don't realize, like I said, with the eye damage, what exactly happens when a person has diabetes too, because, you know, you hear about someone with diabetes being blind or end up blind. What causes that?
Well, usually it's much more related to the excess of blood sugar that you have in the body. So usually those vessels, they go through, there is something called non-proliferative diabetic retinopathy and proliferative. Mainly it's basically on what the doctor or the ophthalmologist will find when they do the fundoscopic exam, meaning checking basically the back of the eye. Usually it's much more to do with the vessels get tortuous. Also, they start suffering even from cataracts. Patients who are diabetic, they also suffer from macular degeneration, cataracts, and all this is all because of having a very high blood sugar in their blood. Wow.
Okay, so that's kind
of like the easiest way to
Right. Oh yeah. Well, saying that's in other words, you know, be very careful, because if you're diabetic, you can end up, you know, I mean, that's really important. You know, I mean, you don't want to lose your eyesight, and it's very easily, from what you're saying, well, not easily necessarily, but if you diet, exercise, you can take care of that, keep it under control, where you won't have to worry about losing your eyesight or diminished eyesight, if anything. Right. Okay. Well, Doc, also, we were talking about, I know, well, we weren't talking about it, but I know that we were talking about the ulcers. But is that just caused by circulation? Poor, I mean, is that also a contributing factor, poor circulation, that would cause, you know?
Well, actually, the cause mainly for the foot ulcer is, first of all, they would have, diabetic patients, they have damage in the nerves, especially in the nerves on the lower extremities. That is also because of the high uncontrol, because with diabetes you have microvascular and macrovascular. That has to do much more with the damage that occurs in the blood vessels. If they are the smallest vessels in the body up to the biggest vessels like the coronary arteries or the aorta, things like that. Usually what that happens is that with the nerves, they're so damaged and they don't have blood supply. Also. So that's when the first thing that a diabetic patient suffers is mainly loss of the vibration when you do the test, and also sensation. And then later on, also when you have uncontrolled blood sugars, it's also much more prone for the bacteria to continue to proliferate. They live, you know, it's much more, when they have food ulcer, it's much more what we call polymicrobial. It's kind of hard sometimes to treat. Well, basically if you try to cover as soon as it's diagnosed with multi-antibiotic therapy for the patient.
Okay, so basically it's almost like, I had a dentist a while back, bacteria grows, bacteria love sugar, so
exactly, kind of like
it's the same thing. We have
grow.
too much sugar, so the bacteria are gonna, you know, in these ulcers and stuff are gonna just proliferate. We got 5 more minutes after this break, and we're gonna be right back, and we're gonna talk some more about diabetes and obesity.
Perfect.